This is my teaching tool for Cinnamon. Meet our patient, Mike. Mike is a Caucasian middle-class male who is 52 years old, and he is a middle school teacher and currently married to his wife, Lorraine. Mike was admitted to 4B South at St. John Regional Hospital after falling down the stairs at his home, hitting his head. He didn't suffer any major injuries, however, his doctors are keeping him admitted because they're concerned as to why he fell. Upon obtaining a thorough history, Mike mentions that lately he's been noticing a slight shake in his left hand and that he's been feeling a little more unsteady on his feet than usual. After hearing this, his wife mentions that lately she's been noticing that he's been speaking slower and even sometimes slurring his words. She says she didn't think much of it before, but now, after all that's happened and hearing what he's just said, she's worried that something more is going on. So the doctors run more tests and they come to a diagnosis. Mike was soon later diagnosed with stage 2 Parkinson's disease, for which he's prescribed Cinnamon. Mike is devastated and has been referred to a therapist for counseling, but Lorraine does not seem to fully understand the diagnosis, as she has made a comment of how once Mike gets on this medication and then they finally get him through this, she's going to take him on that trip to Italy that he's always wanted. We realize that Lorraine needs more teaching regarding what the process of Parkinson's is going to look like, so we provide her with the following information to better her understanding. Parkinson's is a progressive disease of the brain, which mostly affects the brain cells that produce dopamine. With Parkinson's, these brain cells begin to die and dopamine levels decrease. Because dopamine is responsible for making our body movements smooth and controlled, a significant drop in dopamine levels will cause Parkinson's symptoms to appear. Because these brain cells are dying, they'll continue to die as the disease progresses. And even with medication therapy, Parkinson's is irreversible, and unfortunately there is no known cure for Parkinson's. This is when we give Mike and Lorraine our brochure for Cinnamon. There. So on our first page here, we've got what you should know when your doctor prescribes you Cinnamon. Underneath, we've got a blurb of what Cinnamon is. And Cinnamon is also known as carbidopa-levodopa, and it is an anti-Parkinson medication used to help balance chemicals in the brain, dopamine and acetylcholine. Cinnamon is prescribed in hopes to relieve rigidity and tremors, and hopefully increase quality of life for those diagnosed with Parkinson's. So next, when we open up our brochure, we'll come here to dosage information. And underneath here, we just have a little blurb regarding just typical information to know about dosing. And it's that it will differ for everybody, and it just gives you an example of what a typical dose may look like. 25 milligrams of carbidopa, 100 milligrams of levodopa 3 times a day. And at the bottom of this page, we've got a little example of a label for that prescription. When it also says under this general information that when it's used to treat Parkinson's symptoms, that as the disease progresses, you're going to need larger doses of Cinnamon to relieve those symptoms. Underneath, we have when should Cinnamon be taken, and it explains how Cinnamon should be taken 30 to 60 minutes before a meal, because when you have food in your stomach, that food takes 1 to 3 hours to digest. So if you take Cinnamon while there's food in there, your Cinnamon's going to take that long to digest as well. So if you take it before you eat, your Cinnamon gets to be absorbed into your body before food's ever introduced. It also mentions that when you begin taking Cinnamon, nausea and vomiting may occur, so it may be best to eat a little snack with your Cinnamon. And this could be like graham crackers, just making sure that there's no protein in it, because protein uses these certain carriers to get to the intestines of the digestive tract. And Cinnamon also wants to take those carriers to get to the intestinal tract to be digested into the body. To be absorbed into the body. So if you eat protein while you're taking your Sinemet, it's going to affect the absorption because those carriers are already filled with protein and not as much Sinemet's going to be able to be absorbed. So long story short, it's going to slow the absorption of your Sinemet if you eat protein with it. And finally, on that page, we have, what do we do if we miss a dose? If we miss a dose, you take it as soon as you remember, but if it's close to the time of the next scheduled dose, then you forget that missed dose altogether and you just continue your medication schedule as normal with that next scheduled dose. Our next page we'll see is potential side effects, starting with common side effects, and those include dizziness, lightheadedness, nausea and vomiting like we've mentioned, headache, cold-like symptoms, which is a cough, sneezing, stuffy nose, loss of appetite, sleep problems, uncontrollable movements. So these symptoms, or these side effects rather, are very similar to the symptoms of Parkinson's. If any of these side effects do occur, you're to notify your healthcare provider right away, as they can help you manage those symptoms, because sometimes the benefit of the drug is worth more than scrapping it all together because of the side effects. However, if you experience serious side effects, which are listed there, such as mental and mood changes, which could be confusion, depression, hallucinations, and especially suicidal thoughts, should be monitored for. Worsening involuntary movements and spasms, and more. If any of those occur, you're to notify your healthcare provider right away because those could be more urgent. On our last page of this side of the brochure, we've got drug interactions, beginning with drug-to-drug interactions, followed by drug to natural food product interactions, as well as interactions with other foods. Underneath that, we have how should we store Sinemet, and it's to store it in room temperature in a dry place, so not in your bathroom where there's lots of moisture, and to keep it away from light. When we flip over our brochure to the back side, we've got follow-up care. And this is just a little example of what kind of care you can expect from your healthcare providers while you're taking Sinemet. But they're going to assess your Parkinson's symptoms to evaluate how that medication is treating those symptoms. They're going to do frequent monitoring of your blood pressure and your heart rate. They're also going to monitor your liver and kidney function to make sure that the medication is not damaging those in any way. They're also going to monitor your CBC, which is your complete blood count. And I've listed a more detailed list of what exactly they'll be looking for in your CBC. They will also do an assessment for toxicity, and it gives an example of what toxicity may present like, which includes involuntary twitching, facial grimacing, spasmodic eye winking, and exaggerated tongue protrusion. Again, they're very similar to Parkinson's in general, so very good assessment is very important for the healthcare providers to do while their patients are on this medication. And finally, we have important points to remember in the middle. And it just gives a few points as to what we should know while you're taking Sinemet, including that it's used to relieve tremors and rigidity in those with Parkinson's syndromes and improving their quality of life, that it should be taken 30 to 60 minutes before eating. It explains what you should do if you miss a dose. It explains what you should do briefly if you experience any side effects. And it also reminds you how to store your Sinemet. So if you ever have any questions, instead of flipping through the whole pamphlet, you've got your main points right there, bang on the back side of your pamphlet without having to open it. Then we're just going to go back to Mike. So after taking time to digest that information of the process of Parkinson's and exactly what the medication, what the process of Parkinson's is, Lorraine asks you, if there's no cure for Parkinson's, then what is the point of taking medication for it? To which you respond, in a healthy brain, there's a good balance between dopamine and acetylcholine. But in a brain with Parkinson's, those brain cells that produce dopamine die, so dopamine is decreased, making there more acetylcholine than dopamine. And it's this imbalance of more acetylcholine than dopamine that makes those symptoms of Parkinson's present. So the goal of medication therapy with Sinemet is to increase the functioning of any remaining dopamine while also blocking some of that acetylcholine in the brain to help bring that balance back more steadily. And this return of the balance is going to reduce the symptoms of Parkinson's. However, you stress to Lorraine that it's important to understand that medication therapy for Parkinson's does not cure the disease, it simply relieves the symptoms so that Mike can live a more higher quality of life. And because some people don't understand what I mean by doing this, I've provided a visual representation with a picture as well as a little auditory and visual link to a video clip on YouTube of the explanation of how Sinemet works in the body. So in the picture, we've got the first scale, which is a healthy brain's dopamine and acetylcholine balance, and it's healthy 180 degrees. But then we come down here to a brain with Parkinson's disease, and here's where it should be. However, on the dopamine side, it is decreased, and acetylcholine is increased. And then we come down finally to the last example, and we've got where dopamine was decreased, it is now brought back up, and acetylcholine, where it was up here, is brought back down here to a more steady balance. To evaluate Mike and Lorraine's learning, I'm going to ask them these 5 following questions separately and discreetly, because I want to make sure that they both have their own separate understanding. I don't want to ask them at the same time, because maybe one will understand and one won't. So I'm going to ask each of them, what's the purpose of taking Sinemet? And I'm going to ask them, will it cure Parkinson's? I'm going to ask them when Sinemet should be taken. I'm going to ask what happens if a dose is missed. And then I'm also going to ask, what should you do if you begin to notice any side effects happening? And I've got the answers all that I'm looking for all provided so that I can compare what they say to those and evaluate their learning. That is my teaching tool. Thank you.